number 50. So now we start from question 51. Or we already have 51, but just repeat it just in case. You see the screen now. Okay, so the first 51 is the most common organism for osteomyelitis, and the answer, of course, it is Staph aureus. And remember that if the same question come, what is the organism? Because acute osteomyelitis in sickle cell anemia, so the answer will be Salmonella typhi. Okay. So we can start now from this question 52. 36 years old butchers injured his index finger with a knife, suffering a deep laceration in the palmar surface middle pharynx. On examination, unable to flex digital DIB or digital interpharyngeal, which tendon is likely to have been injured. So this is common question. He asked about the tendon who inserted in the distal pharynx, and usually it is flexor digitorum profunda. It's very common question. 52 years old man suffer from open fracture. Open fracture or compound fracture mean have a wound. Which is the best management? Of course, this is general question. They must have a scenario, but in the open fracture, usually we better to avoid osteomyelitis, we do external fixation. Next question, 53 years old, female presented with pain after completing her handwork as a typist. She reported drop object from her hand, which is the most appropriate treatment. This is usually, if you see the tip of fingers is supplied, most of the tip of finger except the little finger and the half of the ring finger is supplied by medial nerve. So the most probably this patient have a carpal tunnel syndrome due to compression of medial nerve. So the treatment is a carpal tunnel release or release of the compression on the medial nerve. Next question, 35 years old man, full and sustained fracture, middle third clavicle. Middle third clavicle, fracture clavicle is sometimes not just blister, what we call it H-shaped blister, but maybe sometimes cause some deformity. But here he asked about anatomy. So this is anatomy question. He asked about what is the relation of the middle third of clavicle, which vessel is greater at risk. So of course, superficial vessel is subclavian vein. Of course, artery is more lower and deep, so the answer is subclavian vein. Next question, 63 years old diabetic patient presented with late onset of painless urine retention following a total hip replacement surgery. What the most likely cause of this condition? You know that in diabetic patient due to nephropathy or neuropathy, not nephropathy, due to peripheral neuropathy or affection of the nerve, they have no sensation of full bladder. So the bladder is full, what we called it underactive bladder. It is something like different or the same like neurogenic bladder occurs sometimes in the spinal cord injury. But here is the patient has underactive bladder. Okay. Next question. 50 years old male with dysuria, pain in micturition, tender swelling testes. He is feverish with rising total leukocytic count. What is your diagnosis? Of course, he has dysuria, can be UTI, but have testicular affection. So it is most probably epididymoorchitis or epididymitis. So the answer here, we don't have epididymoorchitis, so the answer is epididymitis. Of course, not testicular torsion. Testicular torsion have severe pain, but not dysuria and no leukocytosis. A woman suffered from arm injury. On examination, she's unable to catch a knife as her hand flex. So when her hand flex, unable to catch the knife. It is important to know to catch the knife, her hand flex. So this is movement. Okay. So what happened to her? loss of sensation over the badge area. Badge area is this area of the shoulder. This area of the shoulder, we called it badge area. This is area supplied by axillary nerve. Axillary nerve, of course, from the posterior cord. So this patient have unable to catch the knife, hand flexed, so unable to make some sort of extension and have batch area loss. So this is both radial and axillary. So the answer is C, posterior cord, because from the posterior cord, radial and axillary nerve arise. So A, B, C correct together. So the answer is B, is C, posterior cord injury. Common question, what is the best investigation for supracondylar fracture? Also nowadays we have a lot of investigation, but still in the orthopedic for the fracture, still the X-ray is a golden rule or golden investigation in the orthopedic, except in joint like knee and the other MRI now is overcame. So the supracondylar fracture, so the best is X-ray. Nerve supply of dorsal interossei, so it is important to know dorsal or all interossei supply by ulnar nerve. So whatever the number, whatever the name, all by ulnar nerve. Young patient with breast lump in the lateral upper quadrant. Mammogram found macrocalcification. What is the most possible diagnosis? Okay, although it is tricky, but macrocalcification, what it means? Anyone? If you found macrocalcification in a lady, whatever the age, what is your answer?
Carcinoma in situ.
Okay, yes. So it is carcinoma. Macrocalcification is diagnostic for carcinoma, whatever the type of carcinoma. So it is very important to know that. So it is duct carcinoma. Next question. About a 62 years old woman presented to her GP with 2 week history of back pain. She has lost 8 cm in height over the last 5 years. Investigation revealed finding normal adjusted corrected calcium, normal, phosphate little low, estimated glomerular filtration rate is, this is supposed to be 96, not 0.96, so 96, sorry. So normal more than 90 prothrombin time is very high. So which of the following is most likely the cause? Of course, this is repeated many times. So anyone knows the answer? Which one of hyperparathyroid?
Primary
Primary.
hyperparathyroidism.
Okay. All right. And again, take care in the exam. If just change the glomerular filtration rate or glomerular filtration rate to become 30, so the answer become secondary hyperparathyroidism. It's very common, again, is very common in exam. The same question you see in exam, just little change, the answer become different. Each question in this series you can find have many answer according to little change in the main statement. Sir, okay. 19 years female presented with a smooth fluctuant mass showing halo sign in mammogram, aspirated, was done. There is no blood, no fluid, refill. What is your management? Halo sign is not for cancer, by the way. So if this patient have a discharge, have a cyst in her breast, so what shall we do? So in this patient, of course, if the any cyst and refill again, it is need to be follow up. So we just discharge here and follow up is required. Okay. Sometimes in old patient, hallucine can be usually in benign lesion, but sometimes it can occur in some cancer, but it is usually benign lesion. So any cyst refill again, so you need to be follow up. 55 years old male patient presented with general fatigue and weight loss with positive Benz-Johnson protein. Again, Benz-Johnson protein is one of marker in the urine. And lytic mean osteolytic bone lesion in the X-ray. What's your diagnosis? Anyone tell me the diagnosis?
Multiple myeloma.
Multiple myeloma. So again, in the urine, we have three marker. We have Benz-Johnson protein for multiple myeloma. We have VMA or phenylmandelic acid for pheochromocytoma. We have 5-hydroxyindole acetic acid or 5-HIA, HIAA, for carcinoid tumor. So it is very important to know that. Okay. Of course, multiple myeloma is not common disease, but it is common in exam because it is one of the shocky question. And usually in the real exam, they put the multiple myeloma question in the first, like the first question, just to give you some shock. And this is one of the policy of the exam. Okay. What is the reason to give steroid in brain tumor before surgery? Of course, you know that the idea is the brain is a closed space and the bone is very hard. So it is important because any tumor have edema. So to decrease the edema, we need to give the patient corticosteroid. So to decrease pre-tubular edema. So this is the answer. Decrease pre-tubular edema. 60 years old lady presented with a creamy nipple discharge. What is the possible diagnosis? Of course, the creamy discharge is not with a cancer. And usually, if they have creamy discharge and it is very old, usually it is chronic smoker, and this condition called ductictesia. In young, we called it subarachnoid abscess. In the past, we called it both as plasma cell mastitis, which is the wrong name. So usually creamy pus or creamy discharge, chronic smoker, old age, so it is ductictesia. And when we treat this condition, apart from drainage, we need to give here two antibiotic, one for aerobic and one for anaerobic, like metronidazole. And this is the only breast abscess or the condition that we give metronidazole in breast, ductictesia. Uh, This is question, although it's common, but it is not important from surgical point of view. What is the type of amyloid in renal failure? So one by one, so we have AL. AL, it is, we have AA. So AL, it is like multiple myeloma or lymphomas. AA occur in inflammation, like rheumatoid arthritis or osteomyelitis, Crohn's disease, chronic infection, and pyelonephritis. Beta amyloid occur in renal failure. So in renal disease, we have two amyloid. If patient have chronic renal failure, so it is beta amyloid. If patient have early stage of infection, so it is AA, so it is pyelonephritis. In the past, before antibiotic, one of the common disease caused deaths in the world is osteomyelitis and pyelonephritis. Now, of course, is not the common disease. So again, AL, it is for multiple myeloma, lymphoma. AA for inflammation like rheumatoid arthritis, osteomyelitis, pyelonephritis, and Crohn's. B amyloid is for chronic renal failure, and trans 13 it is for cardiomegaly, and the globin is not related to amyloid. So just remember in renal failure, B amyloid, in pyelonephritis, AA. In multiple myeloma, AL. Of course, L from light chain, like we have an immunoglobulin light chain and heavy chain. It is just one of the shocky question, is although sometimes is not all question in exams will be easy. So you must have some sticky or query question like this. Next question, a 5-year boy presented with a recurrent episode of sinusitis. The casualty staff surprised to find his liver lying in the left upper quadrant of the abdomen. So instead of the right, the liver is in the left side. Of course, sinusitis and all this can be part of something called rare disease, autosomal recessive, what we called it Cartaginal syndrome. Can have sinusitis, can have sinus inversus, can have bronchiectasis. So it is one of the rare disease called Cartaginal syndrome. Again, some question of this because of sinusitis and other, again, because the MRCS exam is combined with ENT. So you have some question is not maybe not related to general surgery. 52 years old, fell from stair, and his wife believes that he lost conscious for 15 seconds only. Of course, 15 seconds is difficult to imagine, but he lost conscious. He fell completely recovered, and now what we will do? So first, this patient is old, is 52. Forget period of loss of conscious. He have lost conscious. So it is one of criteria of admission and observe. Although in the guideline, must loss of conscious more than 5 minutes, but usually the patient may be not have orientation to time or the relative may be in panic. But once the patient have loss of conscious, so must be admitted and observed, especially in the old people. Of course, I think in one of the paper in the Word, I write you indication to admit in neurosurgical unit and the indication to do CT, and usually done after 1 hour. We don't have CT after 2 hours. If you do a CT, you do it in the first hour. It is important to know, just to know that it is what we mean by admission to neurological unit, because in England, some patient which is stable, we admitted in the observation in surgery. So it means that he admitted in surgical department. But what is have the criteria? We admit him to neurosurgical unit. Okay, so this is the difference. Some countries they don't have this like Malaysia. Next question again, multiple myeloma can be caused by type of amyloid. So multiple myeloma again, so it is AL. And again, just repeat it, AA for osteomyelitis, rheumatoid arthritis, and Crohn's, B amyloid for chronic renal failure, trans-13 for cardiomegaly. Okay. Which virus associated with Kaposi or Kaposi sarcoma? Kaposi sarcoma is angiosarcoma. Although it is old disease, but they found it is more common with AIDS, and also Kaposi sarcoma is also, it is common with human herpes virus 8. So Kaposi sarcoma infection like human papilloma virus, human virus 8. Man presented with head injury show deterioration of glaucoma scale, which becomes 3 with unilateral unreactive pupil. Of course, glaucoma scale 3 is very, very bad. Unreactive pupil or dilated fixed pupil. So this patient will be end stage, and this is dentorial herniation. Next question. 60 years old man is brought to emergency complaining of trouble with speech, inability to form long sentence. What is the artery responsible for this condition? Of course, in exams, they don't write all these. This is anterior cerebral, middle cerebral, all these. So, of course, this patient have something in the space, so it is something in the temporal bone, so it is middle cerebral artery, so the answer is B. 79 years old woman with macrocytic hypochromic anemia, mean bleeding, bilateral axillary, inguinal lymphadenopathy, so they have anemia and generalized lymphadenopathy. Of course, 79, so it is lymphoma, can be Hodgkin, can non-Hodgkin. Usually old age is non-Hodgkin lymphoma. Although Hodgkin lymphoma have a peak, occurring young, and have another peak about age of 60, but the common is non-Hodgkin lymphoma. 50 years old patient came to emergency room assessment for conscious level was done according Glasgow scale. Patient can localize the pain, open eye to pain, abnormal sound with Glasgow scale. So this patient first open eye to pain, so it is E2. Abnormal sound, so it is verbal 2. Patient can localize the pain. I think he better to speak about movement, but he don't mention movement, so we make it M5. So it is mean good. So the answer here can be 9. Of course, in the real exam questions, they give more detail because the statement is more bigger than this. Next question, 35 years old lady presented with bloody nipple discharge. What is the possible diagnosis? Although she is young, so in the young patient, and we can add also no loss of weight. So what it could be? If I add no loss of weight and have bleeding nipple, so what it could be? Anyone?
Adenoma.
Yes, so it is duct papilloma. Okay, so duct papilloma can cause bleeding because duct papilloma, duct carcinoma, all these can cause bleeding in young patient. Of course, after mammogram to exclude macrocalcification from the history, no loss of weight, no loss of appetite. So the answer will be duct papilloma. Patient have an experience abdominal pain, diarrhea, vomiting. Investigation reveal hyperparathyroid. What is the next investigation should be done? So usually if this patient have abdominal pain, this is all manifestation or most of manifestation of hypercalcemia, high calcium level due to hyperparathyroid. But if you need to looking for the higher level, so according to the detail of this condition, so can be something in pituitary
Adrenal.
and some be adrenal. Both is written correct. Both can be correct, pituitary and adrenal. Uh, if you make adrenal, if I need to make it adrenal, what I need to add in the question? Or what you expected if it is adrenal?
Addison.
Not Addison, no, no. It is multiple endocrine neoplasm.
Yes. Yes.
Okay, so if I need to make from surgical point of view, the correct answer is adrenal, which is the most suitable. So I add something like this patient have something related to pheochromocytoma, like high blood pressure, like phenylmandelic acid in urine, something like this. Because and you know that in multiple endocrine neoplasm, they have parathyroid, they have medullary thyroid carcinoma, they have also pheochromocytoma. Uh, Pituitary, because of course parathyroid have no higher center, not like thyroid. Thyroid have TSH or something control of the pituitary. So I prefer the correct answer from surgical point of view to be adrenal and make it like multiple endocrine neoplasm. Next question is 21 years old man. He's hit in cricket ball in the side of the head. Initially has a glaucoma scale 15. 4 hours after arrival hospital, Hawaii is in observing room, dropped to 7. Left pupil dilated, begin deteriorated, extensor posterior of the limb. What is likely change in the vital sign? Although they have big scenario, I suppose it is asking about extradural or asking about something in neurosurgery, but actually ask about Cushing syndrome. So in the Cushing syndrome, so which one you can choose?
BP increase, heart rate decrease.
Okay, so the answer is D. Blood pressure is high and heart rate is decreased. Of course, respiratory rate also is decreased. Okay, so he asked about Cushing syndrome. It's very common to ask about Cushing. 66 years old female presented with a thyroid mass. By the way, before I forget for the question of the adrenal here again, if because one of you mentioned Addison crisis, if I need to mention Addison crisis in this scenario, what I need to add?
Hypokalemia.
Say again?
Hypokalemia.
No, what else? Skin change like pigmentation. Usually in Addison crisis, the patient have pigmentation. Okay, so it's according. I think we have some question like this. After that, we have some question in the thyroid. Very common to have a thyroid question after each other. Before we start to speak about thyroid, we have general rules. The general rules is papillary thyroid carcinoma occur in young age. Young age mean 20 years old. This is first. And spread by lymphatic, so in lymph node. And under microscope, they have empty nucleus or empty cell or look like empty cell, what we called it orphan Annie, and microcalcification, we called it Semmoma body. Follicular carcinoma occur of age of 30 and usually spread by blood and sometimes have osteolytic secondaries in the scalp. And this is why it is important in thyroid examination, you need to remove hijab or scarf or cover of the head. Of course, medullary thyroid carcinoma is occurring in old age and can be part of multiple endocrine neoplasm type 2 and have a tumor marker which is calcitonin and also can have amyloid change. Of course, anaplastic occur in old age and have skin infiltration. So we can see the question usually in the policy of exam. If you have question in some topics like thyroid or calcium or parathyroid, they put the question after each other just to make you, if these topics is you don't study hard or you don't study, so you become in bad condition or you become unhappy. So we can find the first question. 66 years old female, presented with thyroid mass, rapidly growing, has a stridor with change of voice. What is the possible diagnosis? So first one, 66. And her force of voice, so the affect the recurrent laryngeal nerve. So what it could be?
Anaplastic.
Yeah, so it is anaplastic again because papillary in 20, follicular in 30, and the medullary have other manifestation. Okay, so it is anaplastic. Second, 55 years old female with a thyroid mass, also complain of pulsatile mass in her forehead. What is your possible diagnosis? This is typical, you can find in traditional old books, especially like death or Indian book. They have a patient with the swelling and something in the scalp. And as mentioned before, it is important to remove the cover of the head during examining the thyroid. So what this is spread by blood and go to scalp?
Follicular.
Follicular. So it is follicular carcinoma. Of course, the follicular carcinoma, adenoma is difficult to differentiate, but of course it is a carcinoma. Third question is still in the same topic. 24-old woman presented with swelling in thyroid. She has enlarged lymph node in the left anterior triangle of the neck. What is most probably? So what is the answer here?
Papillary.
Yeah, so this is papillary thyroid carcinoma because this patient is 20 something. So again, 20 papillary, 30 or more with scalp or pulsatile swelling is follicular. Old age can be anaplastic or sometimes medullary according to the scenario. 8 years old, still in thyroid. Boy presented with lump in the neck. On examination, found the lump is midline in the neck. Immediately blew the hyoid, move on or move up on tongue protrusion. What is most likely? So what is your answer? Anyone? So it is easy question. So it is just thyroglosal cyst. All right. Okay. So 90 years old man fall down on the flight of stair on presentation to emergency department. Glasgow scale is 14. No localized neurological sign. 1 hour later, vomiting. Glasgow scale deteriorated. He developed fixed dilated left pupil. So again, it is left pupil dilated. So which site you have extradural? Anyone right or left?
Left side.
Left side. So the same side to the left side, extradural hematoma. 25 years old lady presented with swelling located in the anterior border of sternocleidomastoid muscle. Swelling is intermittent and on examination it is soft, fluctuant. What most likely diagnosis? Usually this is swelling appear and disappear, means that this swelling is cyst and become inflamed, so become bigger and disappear, become inflamed and disappear. So what it could be, it is branchial cyst. Esophageal biopsy show a columnar epithelial containing goblet cell. Columnar epithelial with goblet cell mean intestinal tissue or look like intestine. Which is the type of change happened? So if they found the lining epithelia, which is a stratified squamous epithelia of the lower esophagus or the esophagus, become columnar. So what we call this condition?
Esophagus.
Yeah, so it is metaplasia because this is Barrett esophagus, so it's called the metaplasia. Again, Barrett esophagus can have both in the big level, like in the shape of the cell, so it is metaplasia. But if you go to inside the cell in particular, you can find also have some cell have dysplasia. So both dysplasia and the metaplasia can occur in Barrett esophagus. 20 years old lady presented with lump upper outer aspect of the right breast and usually upper outer aspect of the breast with a cancer. But this is 20. She has a firm mobile mass, but it is mobile. What is most likely underlying breast disease? So this is young and mobile. So what it could be?
Adenoma.
Fibroadenoma. Okay. 36 years old man presented with cervical inguinal lymphadenopathy, underwent excision biopsy, show non-necrotizing, non-caseating. So non-caseating mean not TB. Granuloma with giant cell and fibrosis. So what is the most probably? Of course, as you see here, granuloma can occur in TB, can occur in histoplasmosis, can occur in schistosoma, can occur in leishmania, can occur in chlamydia, can occur in foreign body reaction, can be idiopathic. But here, this is 36, and they have granuloma, non-caseated granuloma. So it is, which one of these? A, B, C, D, which one?
Hodgkin.
No, Hodgkin, if I mention Hodgkin, so I mention red Sternberg cell. Multinucleated red Sternberg cell. But this is granuloma. So granuloma can be sarcoidosis. Okay, so it is sarcoidosis. Usually in sarcoidosis, we mentioned they have higher lymph nodes in the lung. By the way, infection mononucleosis is not granuloma. Okay, next question is 49 years old female is due to undergo renal transplant. Apart from EBO, because blood group is essential, what is the following most important matching donor? So again, although it is common question, but he just simple. Apart from EBO, you need to mention HLA-DR. HLA mean human leukocytic antigen. It is discovered in leukocyte, but it's found in the old cell of the body, but it still have the same name. 60 years old man presented with short history of pain in right cheek and right upper teeth. Maxillary sinus infection is diagnosed. Sinus is partially prone to infection because this is great question for long time. The student answer it wrongly and say position of the sinus ostium high in the middle wall, which is normal anatomy and is in all individual. And of course, it is one of the cause of sinusitis. But in this question, the answer is because the relation of the front teeth to the floor of the sinus. More accurate, premolar and molar teeth to the floor of the sinus because of the relation. So you can find if you're traveling abroad, for example, after airplane, you can find you have sinusitis and the bear in the teeth. If you have something in the front teeth or upper premolars, you can reflect it to sinusitis. It is common in ENT and dentist. They found the patient with sinusitis presented by pain in the teeth, and the patient with abscess in the teeth presented by sinusitis. Sometimes due to nowadays we put something called implant of the teeth, so they put a nail and have a screw. So sometimes in upper teeth he can perforated the sinus, and the patient have repeated sinusitis because of the end of this nail is in the maxillary sinus. Okay, so I know that in the most of the version of all the question, they write the answer position of the sinus ostium is high in the middle wall, which is correct knowledge, but not correct answer. Okay, sometimes in the question, we put some correct knowledge, but the question asks about something else. So the answer here is E, relation of the front teeth to the floor of the sinus. Next question, a 33 years old female presented with depression, and her investigation revealed that low TSH, increased calcium, and was in antacid. What is possible diagnosis? Sometimes if the patient have high calcium level, that can cause a lot of disease. Can cause peptic ulcer because of the increased calcium, increased gastrin, increased HCl. Can cause abdominal pain due to peptic ulcer. Can cause depression. So they have many causes. So what is this condition called? It is vitamin D toxicity. Okay, so this patient have vitamin D toxicity, so they have all these manifestation, and one of the presentation is depression and high calcium. Okay, I think this is query question, but this is the correct answer. Next question, patient with liver biopsy showing bremphygeneal apple green with Congo red stain. This question is very common in exam. They ask about Congo red stain. Anyone know what is Congo? Of course, you know that in the histopathology, we use in 99% hematoxylin and eosin. We use Congo red stain in only one condition. And this is also this is a famous TV series, I think Dr. Howe, or I forget his name. He make a one session or one series about this, how to use Congo red stain. Anyone know what we use Congo red stain for?
Amyloidosis.
Yeah, amyloidosis. So amyloidosis, Congo red stain is not only used except in amyloidosis. And they give this apple green or green color or trans illuminated green color under microscope, of course. Okay, next, what is the defective gene or oncogene in the breast cancer? So it is BRCA1. Of course, B53 is non-specific, occur in all cancer. ABC, adenomatous bullosis coli, occur in cancer colon. SIC, it is very rare. I think it is in, I forget it, but maybe, yes, it is in glioma. Next question, 60 years old man suffer from abdominal discomfort. He's never attended to hospital previously and usually will. He just retired from a full-time employer as a mechanist in PVC factory. PVC is something related to the plastic industry, polyphenol something. CT scan show a regular tumor in the right lobe of the liver. What is the following lesion? Actually, phenyl, I think is phenyl chloride industry can cause angiosarcoma. Phenyl chloride industry, some sort of the dangerous plastic industry, and it is can cause angiosarcoma. It is very rare because most of the country prohibited this type of plastic industry. So it is angiosarcoma. Next question. 4 years is brought to general practitioner by her mother. She has distress with ear pain in the past 14 hours. She is constantly touching and pulling ear. Of course, baby, he difficult to complain, but he just pulling or crying. While she is sit in the waiting room, her mother noticed discharge, foul smell from the ear, following which pain resolve. So this is, of course, it is acute supportive otitis media, and if we catch the patient before become, we make a hole, something called laryngotomy. This laryngotomy is just to make a hole inside the teeth, inside the ear, so we called it laryngotomy. Okay. Or just tube. I think it's called Gorman tube. Okay, 95. A previously fit young man is admitted after RTA, testify intubated because head injury. So, of course, if the patient intubated means the Glasgow scale is below than 8. So, Glasgow scale is 8, no other external injury, initial cardiorespiratory stability is achieved during primary survey, suddenly become hypoxic after log roll. Log roll is a movement. This is also a common question, like when you move the patient in the theater, move to put in the bed in ICU to examine his back. So what happened? This is a technical fault. So what you expected happened?
Dislodge.
Yes. So,
Dislodge.
yeah, so this is tracheal tube displacement. It is common in general surgery if we found, that in bilonidal sinus surgery because it's done in the back, so the patient in prone position. So sometimes if you don't fix it, the tube properly, so can be drop and the patient become in critical situation. Next question, 32 years old female presented with a thyroid nodule, hyperthyroidism, followed by hypothyroidism. So hypo. Of course, if the patient have swelling, can be hypo, can be hyper. But if the same patient, sometimes hyper, sometimes hypo, and the thyroid swelling is tender, so you can suspected thyroiditis, like Hashimoto thyroiditis and all these. So the best investigation is thyroglobulin antibodies. Of course, we go to the triple assessment to make the ultrasound, but before ultrasound, we need the thyroid function test, T3, T4, TSH. And in this patient in particular, you must have the thyroglobulin antibodies. And after that ultrasound, if you found any swelling, you can do fine needle aspirated cytology to exclude malignancy, but it is important to exclude thyroiditis, whatever the type of thyroiditis. Okay. All right. Next question. 35 years old woman complains sustained tibial fracture. Underwent intramedullary nail. So they have operation. A few hours later, so after the operation, he started to have calf pain. Suspected patient might having compartment syndrome. So this patient have compartment syndrome. What is the first management? So the first management, of course, this is patient have intermedullary nail, so no plaster. If the patient have plaster, I remove the plaster. After that, I measure the intra-compartment pressure measurement. So the first line of treatment here is for compartment decompression or measuring. So the answer is intra-compartment pressure measure. So measure it. After that, you can do fasciotomy if you need. 35 years old man presented with severe chest pain. He is tall, slim, history of inguinal hernia repair. If you found in the history they have tall patient, so put in your mind can be morphonoid, so have something in the collagen. Inguinal hernia mean weakness in the collagen. So when he have to, so they have hernia before. His father died suddenly at age of 47 after sudden chest pain. What most accepted diagnosis? So the most probably in this patient, we looking for thoracic aorta dissection. It's usually Marfan syndrome associating with thoracic aorta, not abdominal aorta. Abdominal aorta is not related to Marfan. So what is related to Marfan is thoracic aortic dissection or widening of mediastinum in the X-ray. Okay. As I mentioned before, we have 2 or 3 question statistics or ethics. You have collected data of 87 child, urea and creatinine level before anesthesia to study the effect of anesthesia on hydration. You match them with a normal level. So this is not the same patient because we have in the T or pair T, we use the same patient before and after. But here we compare to the normal and we compare to the normal not in the same patient. So this is chi-square. I think I sent it to this Word document about some statistics. I think it's better to read it before the exam. But if you don't have a time, just read sensitivity and specificity. Next question, 25 years old female presented with ER with sudden onset abdominal and blood pressure. Abdominal onset abdominal pain and the blood pressure is low. Pulse is 110. On examinations is tender all over the abdomen, especially in the right iliac fossa. Of course, the common cause of right iliac fossa pain in the female can be appendix, but usually appendix don't cause severe shock. If you have appendix with severe shock or low blood pressure, so put your mind, it is rupture ectopic pregnancy. And the easy way to diagnose this, just urine pregnancy test. So in any patient with right iliac fossa pain, if we found it is not well deteriorated, no much fever, so most probably it is rupture ectopic pregnancy. Of course, you can ask about menstrual history, give you the clue. Next question, 37 years female presented with an ulcer in medial malleolus. Medial malleolus, of course, it is venous ulcer. Painless skin change around the ankle. History of varicose vein repair. Here, ankle brachial pressure index is normal, so ABI is normal, so it is not ischemia. So the most accepted, it is venous ulcer. Of course, due to venous hypertension. What are the scientific basis of application of tourniquet that use in operation? Tourniquet used in operation, we call it pneumatic tourniquet, to control blood loss and give bloodless field, is inflation of the cuff. The idea of this tourniquet, pneumatic tourniquet, they have put in upper limb and lower limb. You can put in upper limb for about 1.5 hours, in lower limb in upper limb maybe 1.5 to 2 hours, in lower limb 1.5 hours. And it is important to must elevated above systolic after exsanguination. So must be above systolic. So what happened? We have a special tube like this and just elevate the upper arm, for example. And after that, we put this something like tourniquet, it is like sphyngo maneuver, and make the pressure above systolic. So must be evacuate. Of course, before do that, you put a cannula here and the cannula here. So must be have two cannula. The cannula in the other hand for intravenous fluid, and the cannula in this hand is the site of the operation to give local anesthesia. So it's called local intravenous. Elevate the limb. After you put a cannula, elevate the limb and make like a massage. They have a special tube to make a massage, and after that, put a tourniquet. Of course, above systolic pressure. It is not above the main arterial pressure. Of course, main arterial pressure is diastolic plus the third of pulse pressure. Okay. Pneumatic tourniquet is very important because it's common use in orthopedic. A 20 years old man presented with 24-hour history of severe anal pain and fever. So it is infection. With a history of 1 month perianal discharge, diagnosed as perianal fistula. On examinations, they have perianal abscess. What is the best treatment? Of course, for fistula, we do fistulectomy, but because the urgent now is an abscess. So incision and the drainage of the abscess must be done first. So incision and the drainage of the abscess. In England, if you make incision and the drainage of an abscess, you need to send it for culture and sensitivity. Why we send it for culture and sensitivity? Because if it is E. coli or GIT commensals, you need to ask the patient to come again after 3 weeks or 1 month for examination under anesthesia, because this patient most probably have low or beginning of the perianal fistula. If the patient have repeated perianal abscess and fistula in England, not in other country, also with trimming the edge and take the edge to histopathology, because Crohn's disease is common in this country, and the Crohn's disease can also be presented by perianal abscess or perianal fistula. Okay, of course, in our country, we don't do histopathology, but at least it is important to do culture and sensitivity and for aerobic and anaerobic. After that, of course, after incision and the drain, you need to deal with the fistula maybe after 3 weeks or 1 month, just till the edema and all this become solved. Okay. All right. You notice the nurse with practice a minor procedure in the ward which lack evidence of any reference. What you will do? In the NHS, National Health Service, we have a cascade. So in the nurse have a problem, just make incident report. So for the nurses, make incident report, tell the senior. After that, if you have a senior problem with the senior, you tell the head of department. If you have a problem with the head of department, you can tell the manager of the hospital or contact the National Health Service or what we call the GMC, General Medical Council, which is equal Malaysian Medical Council in Malaysia. So it is like step ladders or cascade or hierarchy in the complaint. 26-week gestation suspect to have perforated viscous. What is the most accurate investigation to diagnose the case? Of course, because the golden rule to diagnose the perforated viscous is erect chest X-ray, but this patient is pregnant, so it is difficult to do X-ray. So nothing to be done except abdominal ultrasound. Also, you can find free fluid, you can find any adhesion, something like that, but we don't do X-ray. Okay, of course, the CT, X-ray is the same, MRI, all this is contraindicated. So the only way is abdominal ultrasound. After that, by laparoscope, you can solve the problem or by upper midline incision. Okay. Uh, what is the best long life or long-term management of post-phlebitic syndrome? Post-phlebitic syndrome, this patient is liable to have DVT, and deep venous thrombosis can complicate it by pulmonary embolism. So we give the patient long life warfarin. We have the same question, and the patient take oral anticoagulants or have peptic ulcer. So if this patient have a peptic ulcer and you give him anticoagulant or oral anticoagulant, he will bleed more. So anyone, what the treatment if the patient have post-phlebitic leg and have peptic ulcer, so contraindicated to give him oral anticoagulant. What shall we do? Anyone have an idea? If patient have deep venous thrombosis, contraindicated to give him oral anticoagulant. You're afraid that deep venous thrombosis can spread to the lung and cause pulmonary embolism and the patient die. What shall we do? Something by intervention radiology. We put something called IVC filter, inferior vena cava filter. So the treatment is inferior vena cava filter. Of course, not treated the deep venous thrombosis, but just to avoid pulmonary embolism to happen. Okay, but in this question, we just give the patient long life warfarin. You conducted a cross-section study measuring blood pressure of certain population. What is the type of data you will be obtained? Of course, if you need to follow up the blood pressure of anyone, so you need to be regular. So this is what we call it continuous. Even in the same person, you need to know progress of the blood pressure or blood sugar. So it is continuous follow-up. So the answer is continuous. Next question, which is common and have two versions. The first version is 35 years old woman underwent lab cholecystectomy, discharged at home in good general condition. 1 month later, she developed jaundice. pale stool, dark urine. What is most accepted diagnosis? So we have 1 month later. What is your answer? Anyone?
Common bile duct injury.
Injury. If I mention that it is 1 week, what it could be?
The stone.
Okay. All right.
Polydocoidosis.
So again, this is very common question and come in 2 versions. 1 month, so it is common bile duct injury, because if you injure the common bile duct, is healed by stricture. So this stricture makes some sort of stenosis. It take a time. It just change 1 month to 5 day, 1 week. So the answer is slept or missed common bile duct stone. So again, it is very important to notice the difference in this question, because one of the common failure in the MRCS Part A is the student knows the question. So, okay, I remember this question. The answer is common bile duct injury, but he don't notice that. He make it 1 week instead of 1 month. Just change one word makes the answer difficult. So this is why you can find some student failed in MRCS Part A and say, all this question, I heard it before. I know it. Most of the exam, 90% of the exam, I know the question. And I know the answer. But why I failed, this is because he don't notice this little change. Okay. Next question. 43 years old lady underwent laparoscopic cholecystectomy, presented post-operative with a colicky, abdominal pain, and jaundice. She proceeded for ERCP after the maneuver. She feverish and jaundice with severe abdominal pain in the right upper quadrant. What is the most likely diagnosis? This is also something of complication of ERCP, but presented with jaundice. Because you know that the common complication of ERCP is pancreatitis with severe pain, but no jaundice. But this presented with jaundice. So what it could be?
Cholangitis.
Yeah, so this is ascending cholangitis or acute cholangitis. Although it is not common, the common is acute pancreatitis, but if the patient has jaundice, so it is ascending cholangitis. Okay. Next, 50 years old male presented with dry gangrene in the fifth toe. Investigation was done and revealed long segment occlusion of superficial temporal artery. Of course, the common cause of occlusion is the end of superficial femoral and the beginning of popliteal. With only one patent run off in the posterior tibial artery. What is the most appropriate management of this situation? Of course, we don't found option here to put a stent. No, they have the right angioplasty with insertion of the stent. Okay. So, of course, we don't do the amputation. Not. So the answer here is the angioplasty with insertion of the stent. Okay. In some version, he don't mention put a stent and he mentioned bypass. But nowadays, most of the femorodistal or bypass is not done because the advanced of the stenting or insertion of the stent. Okay. So the answer here is angiography or angioplasty with insertion of the stent. Next question, 55 years old man presented with history of progressive dysphagia, difficult to swallow over the past 4 weeks. For the past 5 years, this is important. He's regularly attend general practitioner with symptom of dyspepsia. So it means this patient have 5 years GERD, gastroesophageal reflux, not treated. So he don't take a medication. He don't obey the doctor advice. So what is the accepted cause of dysphagia? So now this patient have complication of GERD and now has worse dysphagia. So what happened to this patient? Anyone?
Carcinoma.
Yes, and usually what type of cancer is adenocarcinoma? Lower esophagus adenocarcinoma. Okay. A well-known cause of cancer head of pancreas presented with jaundice, painless. So, of course, cancer head of pancreas presented by painless jaundice, unremitted jaundice, PET scan. PET scan is positron emission tomography of body show liver met. Of course, if the patient have no liver met, we can do weapon operation. But if the patient have liver met multiple, so it is have a palliative treatment. So the palliative treatment usually is the ERCP and put a stent, just the patient don't die from jaundice and can die from other complication of the cancer head of pancreas. Next question. Case of intermittent claudication of the calf muscle with loss of pulse below the knee only. Where is the most probable site of the arterial occlusion? This is also common question because, of course, as we mentioned before, it is superficial femoral artery, or more accurate, at the end of superficial femoral artery as the adductor canal just before become popliteal artery. 8 months screaming child was brought by his mother, described passing a red currant jelly. Red currant. Currant here is type of grape, not currant like currant water. It is currant by A. Currant jelly, it is a type of grape, not seen in Asia. Even in Middle East, it is common in Europe, and they make a jam from it. We called it currant jelly. So currant jelly stool is diagnostic for intussusception. A man is done hyperhidrosis operation. Hyperhidrosis operation is thoracoscopic sympathectomy. But on examination, they have ptosis, meiosis, so have Horner syndrome. So he need to ask if the patient have Horner syndrome, so they must be injured of T1. So the answer is C8T1. Of course, although the surgeon cut below T1, but you need to cut by 2 clips and cut in between, because if you use electrical current like the therapy, this electrical current is passed through the nerve and can injure the stellate ganglia. So if you need to cut the sympathetic chain below the T1, either put 2 clips and cut by scissor, or nowadays you can use harmonic scalpel, which is ultrasound wave, not electrical current. But if you use the therapy, you can have Horner syndrome, so don't do that. Renin act on the following. So of course we know renin, angiotensin, aldosterone system. So renin act on angiotensinogen. So this is angiotensinogen. Renin act become angiotensin 1, 2, and become aldosterone at the end. Okay. Next question is a 65 years old man has admitted 2-week history of vomiting. Investigation confirmed benign pyloric stenosis. Okay, of course, hypertrophic or benign pyloric stenosis or repeated vomiting or insertion of insertion of nasogastric tube for long time or vomiting for long time can cause metabolic alkalosis. Okay, so what is the finding matching? So we know metabolic alkalosis. So which one match metabolic alkalosis in this? A, B, C, D, E. Which one matched metabolic alkalosis?
C.
Okay, metabolic
B and
alkalosis
C.
is C. This one, C. Metabolic alkalosis, and potassium is low because of the repeated vomiting. Okay, metabolic alkalosis and hypocalcemia is a diagnostic for pyloric stenosis. Again, can be in baby, hypertrophic pyloric stenosis, can be in adult in ulcer or tumor, can be in adult if you insert nasogastric tube and they make it open for a long time, can be in adult if you have repeated vomiting. 45 years old patient with severe head injury 40 days ago. He now has slow recovery. What's the type of feeding the patient will be need? It is important to know in the feeding of the patient, we have 2 options. So if this patient is supposed to be improved soon, so we put nasogastric tube. If patient not improved soon, is in bad condition or take a time, so it is better to make what's called the big percutaneous endoscopic gastrostomy. So it is different. So what is the aim of the patient and what is the condition? So this patient, he's slow recovery, but he is okay, not in bad, not in deep coma. So the treatment is nasogastric tube. If I mention it is very deep coma and expected to be stay for few months or 1 year. So in this condition, we do big, which is percutaneous endoscopic gastrostomy. Which is artery serve as axis of gut rotation during development. So this is embryology question, and again we have 2 or 3 embryology question, and the answer is superior mesenteric artery. Again, most of the embryology question I send you file about this is either ask about thyroid, parathyroid, diaphragm, and all this. Where is the inferior epigastric artery drain? Inferior epigastric artery drain to. So inferior epigastric artery drain to external iliac artery. Of course, inferior epigastric is communicated or related to superior epigastric, which is from musculocutaneous vein from above. A patient will do hernia repair. His hemoglobin is 9. He put in the list after 6 weeks. How we would give his supplement? Of course, it is not urgent operation, elective operation. The patient not in strangulation, so you can improve his hemoglobin. So what you will do? You give him what you give him. Anyone?
IV iron?
No, not IV. It is just oral iron. Okay, this is not urgent, and of course, blood transfusion indication is below 8, so give him oral iron. Of course, oral iron keeps the stool become black, so but it is can be okay. 50 years old patient with elective hernia repair as a day case surgery is diabetic type 1 and autonomic neuropathy. What is the main problem as a day case surgery? This patient may be not suitable for day case surgery, but what is the problem? Usually, if the patient is diabetic, so is affected sympathetic and innervation. So what happened? The pulse variability, so reduce pulse rate variability. So this patient can have the response and body response or hemodynamic response, especially sympathetic, is not good. So the pulse is variable. Abdominal free fluid collected in the lower part of peritoneal cavity at operation. What is the patient's supine? What is the following fluid collected first? So this is whatever the operation, the first is hepatorenal pouch. Even because in some versions they speak about appendix. Even in appendix, hepatorenal pouch is a little lower than paracolic pouch. Okay, so the answer is hepatorenal pouch. Which of the following investigation most accurate in measuring renal plasma flow? So anyone can answer it. Anyone knows the answer? Of course, the common we see it is the glomerular filtration rate, and the answer is inulin clearance. But in the renal plasma flow, the answer is para-aminobutyric acid. So again, we have 2 questions. First, if you ask about how to measure glomerular filtration rate, so the answer is inulin clearance. But if you ask about renal plasma flow, the answer is para-aminobutyric acid. 12 years old child admit to emergency department have inhaled peanut. So peanut is most likely lodged, of course, due to gravity. So right lower lobe bronchus. Of course, in the exam, they have simple question. You take 1 second, other you take think for it. The patient presented with tachy, hypertension. What is the following hormone decrease in the warming with warming? If you are more warm, so what is decrease is TSH, because TSH increase, thyroid increase if you are in cold weather. Clinical scenario about tooth extraction and the patient develop lower limb numbness. What is the nerve affected? And it is common question also. Lower lip innervation is inferior alveolar. Inferior alveolar is one of the branches of the mandibular nerve. Inferior alveolar nerve, lower lip. It's come from the hole or just foramina in the mandible, inferior alveolar. Of course, if you remember last time, we have a question asked about here, this innervation of the below what is called infraorbital. So here infraorbital and here infra-alveolar. 32 years old man presented with a painful torticollis with no past medical history, and his only complaint that has been feeling rather tired over the last 4 nights. On examination, he has a large rubbery mass in the lateral aspects of the neck, as well as few smaller mass along with the internal jugular vein. So most probably it is lymph node. You correct assume that the muscular neck spasm and the large mass are connected. The most likely cause of this torticollis. So apart from all this scenario, is look like he speak about Hodgkin or lymphoma or whatever, but the answer, the question is anatomy question. What the cause of torticollis is, or irritation of spinal accessory nerve, and again spinal accessory give innervation to two muscles, sternocleidomastoid and trapezius. Next question, we have a lot of debate. So patient with the serum potassium 6.5, what should be immediate step? Okay. All right. Of course, if the patient have high potassium, we start by intravenous calcium glyconate in one line, because intravenous calcium glyconate is give slowly 10 minutes followed by glucose insulin. So if you are two doctor deal with the patient, so one of the doctor gives the patient intravenous calcium, the other is prepare insulin glucose. Usually in this critical situation, it's better to have two cannula, because calcium is giving take a time. So insulin glucose is correct, but the initial step is intravenous calcium. Female presented with 20% burn of the chest over the chest, which is underwent graft treatment. 10 days she came with a sweating discharge from the graft, so you have infection, fever, chest pain. Medication you will give, so you need to give antibiotic for skin, and this is usually fluoxetine. Patient injuries the tip of index finger. The best type of anesthesia used to ring block. Okay, so anyone knows the answer? For ring anesthesia of fingers, what we use?
Lignocaine.
Lignocaine. Of course, lignocaine or xylocaine. Of course, it is contraindicated to give in the fingers, in the toe, in the penis, to give xylocaine with adrenaline, because can cause gangrene. Okay, so it is contraindicated to this, especially in circumcision and finger and toes. Okay, which this is usually very long scenario, and which cell is dependent in the Cori cell of energy. So the answer, if the normal, so RBCs or erythrocyte. If they mention that these patients have sepsis or hypovolemic shock, so the answer is hepatocyte. Okay, it is not important, but it is one of the shocky question. Next question also have a lot of debate. Hyperglycemia is first treated by, anyone knows the answer?
Normal saline. A.
Yeah, okay. So the first treatment for hypercalcemia is hydration, intravenous sodium chloride or saline, followed by something like calcium chelator, like biphosphonate, diphosphonate, whatever is according to what is the cause of the high calcium, but the start is intravenous sodium chloride. Which of this intravenous fluid is high sodium content? And this is common question. Of course, the high sodium content is, which one have sodium content high? Anyone?
Normal saline.
Normal saline. I think you have a table here, so you can find the level of sodium in the common fluid we use. The next question, which is also common, calculate the cerebral perfusion if blood pressure 110/80 and the ICP intracranial pressure is 18. Of course, you need to remember the cerebral blood flow is equal mean arterial pressure minus intracranial pressure. Intracranial pressure already 18. So you need to calculate mean arterial pressure, which is diastole, plus third pulse pressure, which is the difference between systole and diastole, which is 30. So it is 10 plus 80 become 90 minus 18, so 72. Of course, maybe change the blood pressure or the number, so you need to calculate it. And this amount, of course, because in some question asked, is about 15% of the cardiac output. 52 years old man has complete occlusion of inferior mesenteric artery on angio. This is common nowadays because in the EVAR, which is a stenting of the abdominal aortic aneurysm, we don't have an opening for inferior mesenteric, so most probably inferior mesenteric is included. But no symptom or sign of colonic ischemia. What is the following artery is most likely addition source of blood supply? So of course the answer here is the middle colic. To be more accurate, it is the left branch of middle colic artery. So they make this arcade and can help the patient don't have ischemic colitis or ischemia of the colon. Okay, back to the anatomy. All the content or are content of posterior mediastinum except, of course, posterior mediastinum contain aorta, vagus, thoracic duct, azygos. Vertebral artery, by the way, is from subclavian and it is from the neck, so it's not related at all. In fetal circulation, which is a question in embryology, blood from right atrium to left atrium it is through the foramen ovale. This question and usually come first question also, although it is not related to surgery, but it is one of the shock question, child with kwashiorkor. Kwashiorkor is a word, African word mean red hair. It is type of malnutrition in baby. Develop hepatomegaly. This is hepatomegaly, deposition of the fat. This is the answer is deposition of the fat. I found in some version they write lipofuscin, but is not the correct. The correct answer is a fat. Anyone have an idea about this? Lipofuscin or fat? Okay, so make it fat if you don't have an idea. Okay. A child with patent ductus arteriosus, again, is embryology. And left sternum murmur is here. So patent ductus arteriosus give machinery murmur. So it is anomaly. It is shunt. It is shunt to pulmonary artery. It is between aorta and pulmonary artery. So patent ductus arteriosus. After clamping umbilical cord in baby, what is not given oxygenation to blood the embryo? So this is ductus venosa. Elderly patient with an ulcer, painless in his face, and the biopsy show flat and creatine, and this is the picture. So flat creatine, and you can see the picture is not everted, not irregular, so it is benign lesion. What this called? Anyone? This is keratocansoma. It is not common except in England, keratocansoma. It is a benign lesion, mimic like squamous cell carcinoma, but not everted edge. So it is keratocansoma, and usually characterized by keratin in the middle. 4 months child with a failure to thrive and recurrent chest infection, dyspnea increase with lying flat and night and a week came from sleep. So actually, this is not cyanosis, so it's not a fallot. So what it could be, although it is for me, it is difficult question, but when I ask pediatric doctor, children doctor, they say it is common to him. What you expect is the answer? Anyone?
Congenital percute hernia.
No, it is actually GERD. With you, I suspect it is congenital diaphragmatic hernia. But when we look into the pediatric, we found the GERD. For me, it is very strange knowledge, but they found it the GERD. If the patient have this problem, is most probably have a GERD. So even baby can have a GERD, not congenital diaphragmatic hernia. The congenital diaphragmatic hernia, if I need to make the question congenital diaphragmatic hernia, I see that the heart beat is displaced and the patient have some respiratory difficulty, not chest infection, not dyspnea. So this is GERD. And this chest infection due to some sort of aspiration. For me, as a surgeon, I suspect that it is very rare to have in children, especially young, but they found it is common in young. So the answer is GERD. Okay. I know that in the most of the other versions, they write congenital diaphragmatic hernia, but it is wrong. By the way, most of these questions, they have a lot of debate and we discussed by many others and some stuff. So this is a final answer, by the way. Because of the ERCP, so the answer about what is the major duodenal papillae. So the duodenal papillae for cannulation in ERCP is the posteromedial second part of duodenum, of course. Vitamin support collagen, so it is ascorbic acid or vitamin C. This question is very important also. Peripheral neuritis in alcoholic, because peripheral neuritis in non-alcoholic, we give vitamin B12, and vitamin B12 nowadays is sublingual. In the past, it is injection. Now can be sublingual. But if the patient is alcohol, what we give to him? Anyone?
Thiamine.
Yeah, we give thiamine. By the way, we have another medication we give in some hospital in Europe. It's called the femibizole. Femibizole, it is like antidote for the alcohol for the rapid withdrawal, because this is alcoholic problem is big problem in the UK, because suppose the patient he used to drink alcohol for long time, suddenly he admitted the hospital is not allows hospital to bring alcohol. So of course they give him thiamine and they give this medication called the femibizole. We don't need to know it, but you know that they have some medication can be decrease the side effect of the alcohol withdrawal. Okay. Vitamin K is required for normal blood clotting. Which of the following statement is true about the effect and the availability of vitamin K? Of course, affect platelet function, not cause bleeding if taken in excess, of course, no. Provided only by fresh food. It is not correct because vitamin K can be sensitized in the colon by some bacteria. It is depleted by oral broad spectrum antibiotic, yes, because this is broad spectrum antibiotic affects the commensal in the colon, so can decrease the level of vitamin K. Vitamin K is absorption is affected by gastric resection. No, vitamin B12 can be affected by gastric resection because intrinsic factor, and also iron absorption because HCl is important to transfer ferrous to ferric. Okay. Next question, 34 years old patient was in operation with tourniquet. After release of tourniquet, what substance release cause vasodilatation? So if any tourniquet or any obstruction or trapping for long time, so they have release of the some mediator like histamine and the bradykinin. So the answer here is histamine. 7 years old boy presented with abdominal pain, attack of blood stool, and was diagnosed as Meckel diverticulum. Which of the following ectopic mucosa is most found likely? Although it is rare, but one of the site of peptic ulcer can be gastric ulcer, can be stomach, can be duodenum, can be gastrojejunostomy if you have anastomosis, and also can be Meckel's diverticulum. So Meckel's diverticulum can be sometimes can be the cause of gastric ulcer. Although it is not common, but can happen. Of course, to know that for medical interest, we can give radioactive material and to detect abnormal gastric cell in Meckel diverticulum. Of course, this is discovered accidental, so no problem. Next question. is tricky, difficult to remember. In the female pelvis characterized by which of the following? He need to compare between male and female. Of course, the answer here, pubic arch is white. I write this table just to remember, but just remember the main idea, like, for example, in the male, it is, uh, in the female is round, in the male is heart shape or something like that. Patient has macrocytic hypochromic anemia due to iron deficiency, as was taken for endoscopy. What is the site of biopsy will be taken? Of course, if the patient have bleeding, so or something affects the iron absorption, so it's better to take stomach or gastric just to see intrinsic cell or atrophic gastritis or varices or whatever. Okay, of course, duodenal ulcer can cause bleeding but is not affect the absorption. One day neonates have a history of polyhydramnions intrauterine and after birth fluid coming from mouth with dyspnea and cyanosis. So this patient, of course, have congenital anomaly. Fluid coming from his mouth with dyspnea and cyanosis, so means that the trachea and the esophagus is connected. So the congenital esophageal atresia with thoracoesophageal fistula, this patient need urgent operation to close this fistula between trachea and esophagus because he easy die by aspiration. Next question. 28 years old man presented with rectal abscess. Where is the abscess cavity is look like sighted. Of course, ischorectal fossa or ischoanal fossa is important to know the anatomy. So you can see here, so this is the ischorectal or ischoanal fossa. So he asked, for example, above the levator ani. So levator ani is above, so it is blue, so it's wrong. Between the external internal sphincter, of course not, it is lateral to it. Lateral to obturator internus here. So lateral to obturator internus is the lateral obturator internus, yes, is the correct answer. Lateral pudendal canal is correct answer. So the answer here is, what this question is 153. So it is medial to pudendal, not lateral, not it is not lateral, it is medial. So it is medial to internal. Oh, okay. The answer is medial to pudendal canal because it's here. So medial to pudendal canal, and it is medial to obturator internus. So it's written here lateral, so it is wrong. So the answer is medial to pudendal canal. So it's here. Okay. Post-colectomy. Of course, colectomy usually done in familial adenomatous polyposis and some cases of ulcerative colitis. Long period bedridden, heel pressure sore, skin necrosis, what to management? Of course, if you have pressure sore, especially over the heel, is difficult for healing. Sometimes say heel is difficult to heal. So of course, you need debridement, and after granulation tissue is happened, so delay primary closure. So again, as we mentioned before, to put a grafting must not in the bone and must over healthy granulation tissue or muscle. So in some area like the over the heel because of just bone no muscle, difficult. So we wait for granulation tissue. The same occur in the shin of tibia because the skin is just over the bone. Which is true about SCA node anatomy and the physiology. Of course, it is one of the conducted system of the heart. So it is the main conducted system of the heart. Main conductive system of the is not SCA node alone, present in the wall of right atrium, not left atrium. Somatic nerve supply, it is sympathetic, has a vagus supply, correct? None of the above. So have a vagus supply. It is one or not main the conducted system of the heart. A patient with TIA, transient ischemic attack, underwent left carotid end arterectomy, which is common operation done in UK. Immediately post procedure, he developed dysarthria, tongue deviation to the left. What is the most likely diagnosis? So, of course, it is important to know It is left carotid, and the lung deviated to the left. So it is hypoglossal nerve injury. But if the tongue deviated to the other side, so it is another stroke. Okay. So some anatomists say usually tongue tells the truth. So the direction of the tongue in the hypoglossal nerve is the direction of the injury. So they have left, so it is hypoglossal nerve. But if you have stroke, so the tongue deviated to the other side. Foramina of the skull, which glossopharyngeal nerve pass. Glossopharyngeal nerve pass to foramen, jugular foramen. And again, glossopharyngeal nerve give only one muscle, which is the stylopharyngeus, and give pain, temperature, and taste for the posterior third of the tongue. A man had a brain tumor supplied by a very large middle meningeal artery. Which foramina was enlarged or dilated? He just need to know middle meningeal artery is through foramen spinosum. Foramina of the skull is very important, easy question. Of course, middle meningeal artery again is a branch of maxillary artery. Maxillary artery is one of two terminal branch of external carotid artery. Of course, if you ask about foramina, usually ask about middle meningeal. A 2-year-old girl with burned over the whole dorsum of the forearm, plaster erythema. What is the appropriate management? Of course, for a baby, in England, we have different policy because in the most of the country, we have covering the wound. So if you have face or hand or something like that, we cover the wound because of infection and because of the insect, like fly and the flea and the mosquito. In England, because this is cold weather, usually they have isolated burn unit. So in some patient in the face or all this area, we can leave the patient uncovered. Okay, so again, we consider this patient in England. If you consider in other country or you ask it in other country, in oral or something, so they usually have occlusive dressing. But in England, they usually leave uncovered, especially in face. Okay, next question is an 18-year-old girl, cystic swelling, fluctuating anterior border of sternomastoid muscle. What it could be? Anyone? What you expected? This is a repeated question, but what it could be?
Branchial cyst.
Yeah, branchial cyst. Usually is a common anterior to the sternocleidomastoid is branchial cyst. Again, which is common, it is important to know, as we mentioned in embryology, you have many questions. So one of the common question is unilateral cleft lip. Can be cleft lip, can be cleft palate. So again, cleft lip is defect in maxillary process and middle nasal process, medial not lateral. If it is cleft palate, so it is palatine process, not palatine shaft. 18-year-old man after ate canned food feel flaccid paralysis, diagnosed as botulinum toxin, in which does toxin act on? Of course, you know, botulinum toxic now is very common use in medicine because it is a botics, can use for plastic and in many surgical disease like achalasia and others. So botulinum toxic act in which mediator? Very simple physiology question. So botulinum toxin act on acetylcholine. A surgeon is carrying an elective splenectomy for congenital spherocytosis. What is structure divided to mobilize the spleen from the posterior abdominal wall? Very common question. And this structure, of course, it is the ligament, renal ligament. After that, he went to dissect the gastrosplenic ligament and ligate short gastric. Patient came with keloid scar after all the trauma. Best management. Of course, best management is managed nowadays. All these are correct. Keloid scar can be intralesion steroid, correct. Excision and followed by radiotherapy is correct. Oral corticosteroid intralesion is not correct. But what we do nowadays, not all these. Nowadays, we either use laser therapy or silicone cream or silicone patch. So nowadays for colloid, we have silicone patch, silicone cream, or laser. Okay, we don't use this old-fashioned treatment. Okay, a woman with increased TSH, lower limit T4. What is your diagnosis? So TSH high, T4 low. So it is hypo, and this is hypothyroidism, and it is primary hypothyroidism. Typical primary hypothyroidism. Overweight person doing hip surgery. What the following is not considered as a measure for enhanced rapid recovery? Of course, ERAS protocol is mainly for colon, but nowadays you can use it in anything. So, of course, he say not consider. Not consider. Of course, in exam, we don't have like this question, not, but just for teaching. Oral carbohydrate 2 hour preoperative is correct. Weight reduction before surgery is correct. Antiemetic is correct. Epidural anesthesia is correct. The Diazepam is not actually, although it is common use, but not in the ERAS protocol. So Diazepam is a answer, is not used. So Diazepam. Okay. We speak about the skin graft, something called Berocin skin graft. It is done, take it from animal. We don't use nowadays. So it's called xenograft. 28 years old, the primary gravita presented to emergency department with history of sudden chest pain. Her father died at age 42 of the heart attack. She's strictly tall and slim. Again, tall, slim. All this with Marfan syndrome or Marfanoid. On examination, there is not abnormal physical sign other than tachy, 90 heartbeat, ischemic with her anxiety. So most probably sudden chest pain. So it is thoracic aortic aneurysm. I see one case in Malaysia, although it is not common in Malaysia, he have the same presentations. He came many times to other hospital and have chest pain. Each time the make cardiac enzyme is normal and ECG is normal. Fourth time she went to in the morning, so they make an echo. They found thoracic aortic aneurysm. So it is important in one presentation of thoracic aortic aneurysm is ischemic heart, because you know that aorta gives the coronary. So if you have distension or abnormality in the aorta, so the blood supply to the coronary decrease. So it is mimic ischemic heart. So it is important if found the patient is ischemic heart and no find of ischemia, put in your mind thoracic aortic aneurysm. Bullet gun, because it is like not penetrated, so it is just small one. Through the junction of linear semirosis at costal margin of the right side. Okay, this is question in anatomy. He need just to know where you do Murphy sign. So Murphy sign is lateral to linea semilunaris below the costal margin to palpate the fundus of the gallbladder. 72 old man is due to undergo esophagectomy for malignancy, BMI 70 and a half, so have undernutrition. Best feeding immediately. So remember this immediately. So in the past, in the past, many years ago, we just make oesophageectomy and give the patient TBN, total parenteral nutrition. But few years ago, some say if they don't feed the patient by oral, the bacteria in the colon and the small intestine become flare up and can cause endotoxemic shock. And it is important to feed the patient as early as possible. So from this time, in any patient with esophagectomy, we do jejunostomy, what we call it feeding jejunostomy. So the aim of feeding jejunostomy is to give the patient nutrition and the intestine is working. Of course, in this patient, we don't have gastrostomy or others because already the stomach becoming chest, because when you remove the esophagus, make the stomach as a tube, so it comes stomach tube or pull up or stomach to chest, so no stomach. So the only way of feeding is feeding jejunostomy, and this jejunostomy nowadays is considered as one of the step of esophagectomy. Newly born baby girl bus meconium via vagina. After examination, she saw lower vagina is embryological origin. So again, as we mentioned in embryology, this is improper division of cloaca septum. So the patient have fistula between the anus and vulva, and easy to have stool come from vulva. In the patient or vagina, in the patient with a cleft palate presented with defect in embryological fusion of which structure. So again, it is palatine process and not palatine shift or others. It is cleft palate. 50 years old woman presented with 3 cm solitary thyroid solitary swelling in the right lobe of the thyroid gland. So 50, she is old. So what we will do for this patient? Of course, if you nowadays we don't do that because we investigate the patient. Before that, we do all this, so it is some sort of investigation. So by thyroid function, ultrasound, and the next step, or what we will do before surgery, we do fine needle aspirated cytology, guided by ultrasound to exclude a cancer, because the treatment is different. If patient have a cancer, we can have right hemispherectomy, like remove the right lobe with isthmus or left lobe with isthmus. And it is important nowadays to decide it is a cancer or not cancer. Yeah, so the answer is fine needle asparagus cytology. Of course, we don't have safety margin 2 milli or 2 centi or whatever. The safety margin is remove the isthmus. If you are in follicular adenoma or adenocarcinoma in the right side or left side, we don't decide it yet because fine needle don't give you an answer. So what we will do, we do hemispherectomy. We remove the lobe and remove the isthmus as a safety margin, but not 2 centi, not 2 milli. 68 years old man presented with inguinal hernia. During repair, he found to be direct hernia. Which of the following statement is correct regarding direct hernia? Of course, direct hernia in Hassel. So if we consider the inferior epigastric here, so must be medial. So the inferior epigastric form, lateral border. Because this here, so it is the lateral border. So the answer is A. Okay. What is structure open during herniorrhaphy? After skin and fascia, so skin subcutaneous, and after that external oblique aponeurosis. A surgeon make phalangeal incision, which is common for gynae, for access pelvic organ inside the abdomen, so skin, abdomen, rectus sheath, retract the rectus abdominis. Of course, in this area, we don't have posterior rectus sheath. So what we have just fascia or transversalis fascia. So we don't have posterior rectus sheath down, so this position. 65, as you see in exam, usually he make a group of question, like he speak about hernia, speak about thyroid, speak about thyroid tumor. So because this is one of the policy also for exam, because if you don't, for example, you don't have much experience about this topic, so you found that about 5-6 question is gone from you, so it's become depressed. This is one of the policy of exam, by the way. 65 years old man presented with inguinal scrotal swelling in the right groin, which is non-tender. A cuff impulse is allocated as the operation. Indirect inguinal hernia is repaired. The cremasteric muscle. So apart from all this history, so this is important. If you need the statement, just scan it because the question started from here. Cremasteric muscle derived from, and the answer is transversus abdominis or transversalis, what is called internal oblique muscle. So it is internal oblique muscle. Okay. Transversus abdominal gift transversalis fascia, external oblique aponeurosis from external oblique muscle. So the answer here, internal oblique muscle. Next one. 19 years old man assaulted and sustained injury in the right side of his head. After 2 weeks, he noticed right eye is dry and couldn't produce tear. Okay, so the question is also anatomy. From which ganglia post-synaptic fiber arise to supply the lacrimal gland? Again, as we mentioned, in head and neck, we have only 3 ganglia. What ganglia? Sphenopalatine ganglia, or sometimes called trigopalatine ganglia, and mandibular ganglia. This is the commons. So, of course, lacrimation is related to sphenopalatine or trigopalatine ganglia. Okay. Embryology question. What is the nerve supply of second branchial arch? Second branchial arch, the nerve supply is the facial. And again, facial supply all muscle of the face, platysma, posterior belly of the gastric, sternohyoid muscle, stapedius muscle in the middle ear. By the way, glossopharyngeal supply only one muscle, xylopharyngeus. Pharyngeal diverticulum or pharyngeal pouch is pharynx occur between. It's actually occur between the fiber of inferior constrictor muscle. And the inferior constrictor muscle anatomically is 2 parts. One called the cyropharyngeus and the second is called the cricopharyngeal. So the C is the correct answer. Okay, so you can find some question like posterior relation of the kidney include which of the following? Posterior relation of the kidney, of course, it is including the muscle like psoas major, muscle, quadratus lumborum, and all these. So here is the psoas major or psoas muscle. 1 cm basal cell carcinoma of the nose of the woman removed up to mucosa level and ala cartridge. How to cover? Usually in the, because the skin here is difficult, so the only have is rotational flap. So what we called it local rotational flap. Of course, we don't bring split thickness from other part because different color. So they usually local flap from the face. What we call it rotational flap. Post-hysterectomy patient have loss of high-pitched voice. This is common question. So they can find the patient, tell you, I am a teacher. After the thyroid surgery, I can speak, but difficult to speak in high tone. So if difficult to speak in high tone, so means that it is injury of the cricothyroid muscle, which is supplied by superficial laryngeal laryngeal nerve. Of course, if the patient have injury of the recurrent, if the bilateral, they have suffocation. If unilateral, have hoarse voice. But superior laryngeal nerve can be injured during ligation of superior thyroid artery in the upper pool. So, of course, the superior, it is called external branch of the superior laryngeal nerve. Of course, unilateral. A man with prostatism on PR, posterolateral ridge of palpation, what is the structure? Of course, this is a very tricky question because when you put your finger in the anus or in PR, of course, between it and the prostate, you feel the superficial, the muscle, what is cover the rectum, what we call it puborectalis muscle. Of course, it's very tiny muscle, but from anatomical point of view, what is between your finger and the prostate is puborectalis muscle. Next question was also tricky. What structure is felt in BV, per vaginal examination anteriorly, at the level of the cervix? Okay. So at the level of the cervix, so it is dome of bladder. At the level of vagina, which is lower, it is the base of the bladder. Okay, so cervix, so cervix here, so suppose up. So it is the dome of the bladder. But in vagina, the base of the bladder. So you can find some say base of the bladder if the question about in vagina, dome of the bladder if asked about the level of the cervix. So just remember which level. So if the cervix, dome of bladder, if vagina, base of the bladder. And this is a picture, you can enlarge it. 50 years old woman presented with history of fecal incontinence of past few years. She had prolonged difficult first stage labor 20 years ago. Of course, again, repeated prolonged multiple labor can cause weakness and affect elevator ani and affect the sphincter. Both urethra can cause urgency or stress incontinence or anal sphincter. So the nerve affected, not damaged, just affected is within the nerve. And again, it is S2, 3, and 4. Okay. 42 years old multi-paras woman admitted to emergency department due to pelvic discomfort. Duty gynecologist diagnose uterine prolapse. Anatomical structure, significant dike support of the uterus. For uterus, forget this picture, but I just explain the anatomy. All are correct, but the main anchor or the main support, because all this ligament is attached to transverse perineal muscle, which is part of perineal body. So the correct answer is transverse perineal muscle. Of course, it is present in male and female, so this just to put this structure. In physiology, you have something like cardiac cycle. Closure of tricuspid valve occurs the onset of the which phase of cardiac cycle? The usual closure of the valve in isovolumetric contraction or isovolumetric phase. So it is isovolumetric contraction. Type of epithelial urinary bladder, very common question, is transitional cell carcinoma, although in some cancer, they can have squamous cell carcinoma if the patient have metaplasia like in schistosoma occur in Japan like schistosoma japonica or in Egypt like schistosoma hematobium. 31 years old presented with ureteric colic referred to inguinal region. Why the pain is referred to inguinal region according to dermatome supply? Again, dermatome is very important. And again, this is spread because what we called it loin to groin. So loin to groin, so it is more than one segment. We know the umbilicus is T10, but kidney to groin, so it must take from T11 to L1 because it is long segment, so it's long dermatome because the kidney, ureter, bladder, so started from T11, T12, and L1. Okay. We just lost the question, so you can see what happened in septic shock. So again, in sepsis, as you see, peripheral or vascular resistance is become low because of vasodilatation. So the answer is A, cardiac output is high, heart rate is high, but systemic venous resistance is low. Okay. I will stop here and we continue next time, inshallah. Next, what is today? Is next Monday,